Zoom into the region of Central Africa, bringing you stories making headlines there. And we explore them with our analyst, our resident analyst, geopolitical analyst, Aaron Ngambi, to put you up to speed in terms of what's going on there. Aaron, good morning. Thank you. How are you?
Good. Thank you, Asanda, and good morning to you.
Always great having these catch-up sessions. Today we start let's go to the Central African Republic, or the CAR. They're launching a $1 billion investment program. What will this cover?
Well, we told that in the Central African Republic, the government has sourced a $1 billion investment in some of the projects that they have long been talking about, and some of these projects are for developmental proposals that they, in terms of democracy and development, and also as well as championing some of the things that has been part of the long government strategy to try to bring stability to the region and to the country. So it is a vast amount of money that is meant for various areas of development, which they have long been talking about.
It was the first time that this roundtable discussion on this investment was held by the CAR, inviting international investors. What about this timing is important to note?
Yes, the timing is very important to note, because we know that in the CRA, there's been a lot of events and things that are coming up. We've talked about elections before. And that is very important to boost confidence, and also to attract foreign direct investment, and also for the regime to try to appease the people and make people think that the government is working and trying to do something to achieve some of the things that I've said they've long been talking about in terms of development. So I think the timing is crucial, and it is all calculated and designed to try to rally the people behind the government.
For how long will the program be rolled out? Over what period of time? And do you find that sufficient and adequate?
I think it's debatable in terms of how long this program will go on, and if it is sufficient or not. I think what is important is the deliverables. I think that if they can achieve the things that they've said they'll achieve in this period of time, and with this kind of money that's coming in, I think that it's well and good. I don't think that it should take long, or it should take a short period of time for them to be able to achieve this. What they need is to actually deliver tangible results.
What sort of projects are crucial to prioritize for the CAR government, besides what they plan to do?
A lot of things. Number one is actually infrastructure development, in terms of, even not just infrastructure development, but in terms of things that meet the basic necessities of the people there. So you need to be able to prioritize things that will have a direct impact on the lives of the people in terms of basic necessities. Do people have water and sanitation that is up to the standards that are required? But also it is things like security. The Central African Republic is a country that is troubled with a lot of threats of insurgencies and things like that. So that is also some of the things that they'll be looking at. How stable is the country is, and what kind of investment they can put into that to make that the people are secure and stable.
Let's take a short break. Aaron, do stay with us. We'll continue with our central rep. Aaron Ngambi is geopolitical analyst, joining us for that. The next topic is also with the Central African Republic. Stay with us.
AUSISA, the Association of Water and Sanitation Institution of South Africa, is a platform uniting Africa's water professionals. This November, Africa leads the conversation on water and sanitation. Join global and African leaders at the AUSISA Africa and Global South Dialogue 2025 from the 9th till the 12th of November at the Emperor's Palace, Johannesburg. From policy innovation, this is where action meets collaboration for a water-secure future. Register today at ausisa-watersan-dialogue.org or follow at Ausisa on social media. Ausisa, working together for sustainable water and sanitation security in Africa. Get the news, music, and lifestyle of Africa on Channel Africa, the African perspective.
Exploring headlines, the latest and key challenges in the Central African region. We are joined by geopolitical analyst Aaron Ngambi to unpack, and we continue as we've started on that, our time being 20 minutes past 6 Central African time. Let's stay with matters then in the CAR, Aaron. Health systems there are under strain, and this is due to USAID funding suspensions. The country already grapples with low vaccination rates. That's one of the issues there in the health sector. In which other ways is this health sector impacted?
Yeah, the health sector is another area that requires a lot of investment in the Central African Republic. Like you talked about, the rate of vaccinations, and this is for under 5 children or babies, is practically less than 20%. So you find that there's a lot that needs to be done in that area. With the withdrawal of the US aid funding, there's been a lot of problems in terms of even basically reaching the bare minimum to address the needs of the people. But the Central African Republic health workers have tried to be innovative. We've seen them moving from one area to another area, even using canoes to go to areas where are almost impassable. So the challenges are huge. The health facilities are understaffed. There is no money to pay health workers so that they can be able to attend these needs. So with that kind of investment that we're talking about coming into the country, the healthcare is one of the areas that they have to look into.
Doctors Without Borders has intervened to assist in the country as well. Are there security concerns for MSF in terms of how they're getting around, and how are they working around them to make sure that they also reach the remote areas that need to meet vaccination targets?
Yes, the Doctors Without Borders has been on the ground. And like I talked about, security is a big thing in the Central African Republic. And because there is no money in terms of donor funding and aid that has been coming in, organizations such as Doctors Without Borders are using up some of whatever resources they have and working with the local health workers to create ways to meet the demands of the people in the health sector. But this hasn't been easy. It's been very challenging. I think they have a budget that's constrained, but they're putting priorities on issues that are life-saving. The vaccines is one of the campaigns that is being taken seriously. And like I said, the rate is about below 20% of how many people are vaccinated and children been vaccinated. So it's a huge challenge, but I think that the Doctors Without Borders have some kind of leeway to work with and maneuver because they have international connections.
Any specific groups that are being targeted? You mentioned children under the age of 5.
Yes, so these vaccines are basically, in most cases, most countries do vaccinate children that are under the age of 5. But also we've seen that there's some vaccinations that are specifically targeted for women, and also vaccines that are supposed to be targeted for those who need, with conditions that need attention. So there's a lot of work to be done, and I think that Doctors Without Borders are doing everything they can to try to salvage the situation.
Let's move to the Democratic Republic of Congo now. There, also staying with health matters, Ebola has reportedly killed 15 people. Can we expect this figure to rise?
In fact, I think we are now at 16. At the time of reporting was 15 people. And there is an immediate threat that the virus will spread rapidly because previously from 2018 to 2020, when the cases were reported, there was only about 6 people that died. So this is almost the second most severe period that we have seen in terms of recording the victims of Ebola. So it is a scary situation. I think 24 cases have been reported already and 16 have died. And it seems like there are more cases that are coming up. So we hope that the situation stabilizes.
And Ebola is not new to the country, to the DRC. It's the 16th outbreak that's been recorded. What do you make of the Health Ministry's response to this latest outbreak as far as proper planning is concerned?
Yeah, I think the first outbreak of virus of Ebola was recorded in the DR Congo, I think in 1976 or something like that. There's been 16 different cases, different times, different phases that, like you've mentioned. And it seems like Ebola is, most victims of Ebola, specifically from the Congo. We saw cases in the past in Uganda and surrounding areas. But it seems like the Ministry of Health has tried to they've tried to take precautionary measures which are not very sufficient, and we hope that they can up their game, because this is a virus that's been around and this is something that they have experience dealing with. But I think right now the problem is that they do not have sufficient help and funding, like we've seen because of the USAID and other organizations from the United States that not being able to assist as they have done in the past.
How is the World Health Organization helping, if it is?
Yes, the World Health Organization takes the cases of Ebola and other diseases such as that very seriously. I know that they have had meetings and they're tracking and trying to see that this disease does not spread as much. But they've had meetings with the Ministry of Health. They've had preliminary preparations on how they can effectively combat this. But I think, like I said, it also requires a lot of resources to fight Ebola. If you remember, for example, you need a lot of PPE, equipment that you need to actually stop the spread. So we hope that the situation stabilizes. But like I said, Congo has had its fair share of this disease, and that they have some experience in dealing with it, especially health workers, and that's exactly what they're trying to do.
All right. Also staying then with the DRC, hundreds of Congolese have meanwhile gathered to demand the removal of a deputy commander of the 33rd military region in the DRC armed forces. What did General Kasita Mukunda do?
General Kasita has been accused or is implicated of having collaborated with the M23 rebels. He is now promoted by President Tshisekedi to be a deputy commander of the 33rd battalion. And so people in that area feel like they cannot trust him. They feel like he is a part of a problem rather than a solution. And they think that he is not genuine in terms of providing security and fighting the M23 rebels, protecting the citizens. So the local people are outraged. They're not happy about this decision by the president.
How is he responding, this general, to these allegations?
Well, he just thinks that he's refuted these allegations. He is not happy with what the people are saying, but the people are very much suspicious of him.
There have been previous allegations of certain government officials and leaders being linked to the M23 or helping them in some way, the former president having faced that as well, and he denied it. What does it say about the intelligence or lack thereof then in the DRC if these charges or allegations will be made and then the people are denying them?
Yeah, President Joseph Kabila, the former president of DRC, has been accused of backing the M23 and helping fuel this conflict. And you recall that when he was in South Africa for 2 years, when he went in exile, self-imposed exile, I must say, upon his return, he actually entered the country through the eastern DR Congo, which is the conflicted area. He was welcome, and he came into the country through that route. And this is the part of the country that is completely taken over by the M23 rebels. So they provided a safe passage for him to come home. And so people are very much skeptical about Kabila and this general and other people that think are behind this conflict. The problem is that this is a complicated issue because it borders on ethnicity, it borders on the regional issues, and also it borders on other external players such as Rwanda and Uganda. So I think that the intelligence that the government has could be reliable, but also it is not possible to control every individual when you're fighting an enemy insurgents.
Aaron, we'll leave it there for today. Thanks again. Always great catching up. And we understand you're traveling, so do have safe travels as you jet set your way around the world.
Thank you, Asanda. Thank you very much. Have a wonderful day.
Thank you. Aaron Ngambi is geopolitical analyst, exploring some of the headlines and key challenges in the Central African region of our continent. 6:30 Central African time it is. Let's say good morning to Matapelo Mahape with news headlines.